Welcome to Buckle Up Podcast Universe with Brandon Rush and
Mama Rush.
And today we have Nurse Tiffany joining us, Nurse Practitioner Tiffany joining us. So we're excited to have her on. Thank you all for tuning in. So we have 6.3 million viewers and listeners. We are in 17 countries and we are in 6 continents and counting. We're going to get higher than that. So, all right, here comes Nurse Tiffany, Nurse Practitioner Tiffany. We have her on. Let's see here. I'm recording. Hello.
Hey, Tiffany.
Nurse Tiffany, can you hear me?
I can hear you.
Oh, perfect. Thank you so much for coming on today. Welcome to, we're already recording. Welcome to Buckle Up Podcast Universe with Brandon Rush and
Mama Rush.
And we have here today, Nurse Practitioner Tiffany. Will you tell us your whole name, please, and about yourself?
Well, my name is Tiffany Franklin. I am a certified, board-certified nurse practitioner. I am the owner of Blu Vitamin Infusions, located right here in Charlotte/Matthews, North Carolina.
Okay, well, I have to say this. I saw your Instagram page, and will you actually say your Instagram handle real quick for us, too, if you wouldn't mind?
Yes.
Oh, go ahead. Say your Instagram real quick.
Oh, Instagram is Blue_vitamins_infusions.
Okay, perfect. So I saw your page, and I absolutely love how hip and how cool you are, the dancing and all that. That was great. I love it. It's revolutionary.
All right. Thank you for thinking so. I'm just out here doing it, creating these things on my own with no one to tell me, what to do. So,
you know what? That's because you don't need anyone to tell you what to do. I can tell you from a person who's been in 77 TV shows and movies that you are already a star already. I've seen it.
Yes. Okay, thank you.
Yeah, don't change a thing. Keep doing what you're doing.
Exactly. Okay. Well, Tiffany, I told my son Brandon about a little bit about your history, a little background information, but I would like for you to tell all the viewers, and now that we've gotten a chance to really see each other and you see how I look, and yes. I don't quite remember you. I don't know if you quite remember me at Wendy's, yes. But at any rate, Brandon was looking so forward to meeting you Absolutely. As well today. So with that said, tell us a little bit about your background, your history, how you came to do, and you have the floor.
Yes,
you are center stage to tell us your story.
Yes, ma'am.
Okay, well, if you need to stop me and ask a question, I can do that. Well,
okay, we will.
So I'm originally from Memphis, Tennessee. I had no intentions on going to school or college. I was actually a teenage mom. I had my first child when I was 17. Can you hear me okay?
Yes, ma'am. We hear you good. You're good.
Okay. You're I had my first child at 17, second child at 24, and I was working a dead-end job thinking I was not going to school. It was already hard enough having a kid at an early age. Even me being in aesthetics or nurse practitioners, that was never in my thought process. Okay. But just because I had to do better for my kids. Also, I have a husband. I was with my husband, who was my boyfriend at the time, but
yes, ma'am.
And now, experimenting there and not knowing what direction I was going to go in. I went to school. Became a registered nurse. And
what school, by the way, Tiffany? I'm sorry.
University of Memphis in Memphis.
Hey, there you go. So I had to get that shout out.
Yes, University of Memphis. And I also went to nursing school at Baptist College of Health Science. That was my first registered nurse degree. Okay. Yes. And University of Memphis for my master in nurse practitioner.
Oh, wow. Okay.
So from there, my husband John took him to Charlotte. That's where I am now in 2009. From Charlotte, I started working as a hospitalist nurse practitioner. I work full-time as a hospitalist nurse practitioner as well. And I do Blu Vitamins on the side. So this is like my full-time side kick job. Okay.
Okay.
But I love what I do. First of all, I love hospital medicine. I love that adrenaline. I like taking care of people to see if I know what I'm doing being a nurse practitioner.
Absolutely.
Can I handle this situation without getting the doctors involved and then get them involved?
Okay.
Learning that is my passion. But also I am loving doing what I do with Blu Vitamin Infusions. Okay. Blu Vitamin Infusions, I started out as a mobile IV.
Ooh.
Okay.
Oh,
I
okay.
did that for about a year.
Uh-huh.
I quickly saw how the money wasn't coming in as quickly as I liked.
Yes, ma'am.
It's a great service, but I expanded and started taking all these training courses. I spent well over $50,000 in
Ooh.
training
Yes, ma'am.
because
Wow.
I want to know. I work for the hospital, so
Yes,
what
ma'am.
I do, I have to know. I have to have the certification behind. You know, from messing. If I'm going to touch on people.
Yes, ma'am.
Yeah.
I spent all that money on training. I did the training, and now I have evolved more than just Blu Vitamin Infusions. Okay.
Okay.
My services include Botox, PRP, exosomes. I don't know if you all heard about exosomes.
Will you please explain that to us?
Exosomes are, okay, first, if you want to do anything, first, I would like to do it with your own blood, which is the platelet-rich plasma.
Okay.
Okay.
Uh-huh.
And this is done by drawing the blood, spin it in a centrifuge, and then I take it and I inject it back into the scalp. You'll get that yellow color, which is called the yellow gold.
Uh-huh.
Okay.
If you haven't heard about it.
No, ma'am.
Gold, okay. You can use your yellow gold, your platelets, literally for everything, okay?
Really?
Uh-huh.
For sexual wellness, for your face, for your hair, your scalp, as well as bone pain, joint pain, under eye. A lot of women that suffer with dark circles around the eyes and
Uh-huh.
things like that. PRP, your own blood, will lighten and regenerate your own, heal your own skin from the inside out.
Okay.
Wow.
Man.
It works.
Yeah.
It works. And also, I don't know if you heard about when Kobe Bryant went overseas, when he hurt his ankle.
No, I didn't hear about it. Will you explain that to the audience, please?
Okay, when Kobe Bryant, it was late 2000s or something, he hurt his ankle.
Yes, ma'am.
And I just remember him going overseas to France to get this procedure. And it was the PRP procedure.
Okay.
They take your blood, they spin it, and they inject it into your joints. Okay.
Okay.
So if you're suffering with a lot of arthritic pain, osteoarthritis, any joint pain, you can have your platelets injected into those joints. It will really help the pain. This is new level. If you haven't heard about it, it is the going thing now. So I am so in love with this regenerative medicine. But on the other hand, a lot of people don't qualify or get candidates for platelets because if they have autoimmune disease, they're cancer patients, or on blood thinners, their platelets are not going to be that great.
Gotcha.
So that's where the exosomes come in.
Okay.
Go ahead.
Okay.
Yeah, go ahead and tell us the exosomes too. I'm sorry.
That's okay. Exosomes are like messengers. They are little messengers that get into the cell. They work just like your platelets, but at a more of a cellular level. Okay. They use it. You have like the fish, the salmon sperm.
Yes, ma'am.
They use plant stem cells. They use deer stem cells. They can even use human, which I'm not doing the human because the allergic reaction, that it has a high risk of allergy reaction. But you can use different stem cells, and these exosomes will work and heal the skin just as good as your PRP. Okay, yes, but I always like to start with the PRP because it is your blood. Okay,
absolutely.
And it's power in the blood is always what I say.
Amen.
It's power in the blood. Something that I never knew about. But the exosomes are another thing that is the new next level in regenerative aesthetics.
Okay.
It is the next level. And for me, I use several companies that I just have to, because their products are so good. It's Promotalia. Promotalia is based out of Miami, and I've seen just wonderful results, and especially for people of color, because when I first started this, I didn't think people of color got into this type of service. Botox, Botox, Xeomin. And even to this day, I have a hard time trying to convince people they can do Botox.
Yes, ma'am.
That's a hard subject. It's hard to push it. You know, Black people most of the time don't want to do anything if they don't know about it, if they don't see it, if they
Yes,
haven't
ma'am.
touched it themselves. But it works. So that's one of the things that I'm trying to really educate people and get them to understand. There are things out here to make you look good.
Absolutely.
Make you look good, feel good. And it's just not about looking good. You know, I'm trying to work with people holistically. If
Yes,
you
ma'am.
come in my office, I'm looking at you from head to toe. How can I help you? You know,
Oh, absolutely.
Yes.
that's what I want. I want to look at you holistically.
Okay.
Yes.
And I want to help. So that's my angle. I really, and with my medical background, hospital background, I have to tone it down a little bit, because then I start going internal medicine, but I'm not internal medicine.
Yes, ma'am.
This is the aesthetics part of it.
Okay.
Hey, Tiffany, I have a couple of questions relative to this new treatment options you're giving patients. How much research has been done on that? And what's the background on that with the research? And how long has it been in the United States as a treatable option for hair loss and other, I guess, pain management or whatever? So if you can just explain that quickly, that would be great.
I'm not for sure how long it's been in America, but like I said, when Kobe Bryant was doing it, and that was back in the early 2000s.
Yeah.
Yes.
That's when I first heard about it. I saw a picture of it. I saw a video of how these platelets worked and healed him. And if you watched him play basketball, he was still able to go on and still do wonderful things even after that injury.
Oh,
Absolutely.
It is so many, it's a lot of research out there. And this one class that I've taken, this guy, Dr. Rappaport, he does a lot of PRP for the scalp.
Okay.
How it regrows the hair. And if you're consistent with it, it normally takes 3 sessions back to back.
Ooh.
Sometimes it back to back, meaning once a month.
Okay.
Once a month for 3 months. And then maybe maintenance doses like every 3, 6, or 12 months. Okay. So it's a lot of research out here about the PRP. And that's what I'm saying. And I'm going to say this. Another one is male enhancement. You can actually use this PRP to increase the penis.
Okay.
So people don't know that, but it's out there. And that will be an option for me soon, as well as help women with orgasm, urinary incontinence. So, you know, it's like you're injecting that PRP down in your private area.
Oh, wow. Okay, look, that really is state of the art.
Yes, it's really state of the art, and it's for people who are looking for those things, because everybody are embarrassed or ashamed to talk about those things.
These are conversations that need to be had. How do you screen a patient? Because you mentioned certain patients, you have to be careful. How do you go through that screening process? If they come to your office, or do you meet them in the hospital, or how is that done?
No, well, they come to my office, and I can just kind of show you.
Yeah, show us. Yeah.
I'm in a 1-room suite right now. Hopefully I will be growing soon. Okay.
Yeah, that's all you need right now.
Yeah. So this is just 1 room. It's like 142 square feet.
Okay.
It's good for, I have a chair, keep my medicines, and the refrigerator. So it's about 142 square feet.
Okay. Oh, congratulations on that.
They come here. I like for them to have their labs ready when they come, or I can send them to get labs. But the most recent labs, like within the last 60 days or so, and when I'm screening people, I want to look at their kidney function. I want to look at their liver enzymes. I want to look at their platelet count, what their white blood cell count is. Do they have any infections? Do they have any open sores?
Yes.
Then I get the history,
Okay.
Great.
What's your background history? Do you have high blood pressure, diabetes? Do you keloid? A lot of what color tends to keloid.
Yeah.
Those things are important because that plays a role in how I deliver the medication. Do I inject it, or do I microneedle it? And I can do it all. And I also use a numbing cream to do these procedures as well.
Okay, good for you. Look at all that experience coming for 50 grand. You are an expert in your field, I would say.
I'm trying to get that. And now I've niched down to kind of working on these services and actually trying to introduce it more to the people of color.
Yes, ma'am.
But the hair products and my hair, I have my hair restoration program is where I am doing more of the PRP.
Okay.
Using Grow and Glow products to help with the hair oils. I also use a machine to help me look at the scalp, the hair follicles, to see if you have the inflammation.
Yeah.
This is a real thing, and it takes a lot. It's not overnight. It's not a quick fix.
Yeah, it takes time.
The hair cycle is not a quick fix. You need time for your hair to grow.
Yes, ma'am.
Up to 3 to 6 months for sure.
And then how many appointments is that, Tiffany? Sorry, for a person, I don't struggle with the hair department, but for people that, but for people that do, that's what I'm asking.
Yes.
How long?
These viewers out here. Yeah.
You can, even if you just say if you have a lot of shedding, you can still. I do 1 sessions as well. If you have a lot of shedding, you can still get PRP for people who doesn't have hair coming out, but it's just shedding more.
Okay.
And so you said that process takes how long for results to?
Yeah, so they would know.
So people will know exactly how long that will take and the results they should see, because people want to see overnight fixes.
Well, we know it's not
overnight. We know it's not overnight.
Well, that's what I said. Their hair cycle may take anywhere between 3 to 6 months. However, for me, for instance, I've literally done this myself, injecting my own scalp. Okay. Because I don't have people to do me. I do other people. I can't find anyone to do me because I'm particular like that.
Absolutely.
Yeah. So I saw a difference immediately. Okay. My hair will stop shedding. That's another thing. And I didn't mention this before. I suffer from hair loss. So that's my passion. That's how I got involved with being more focused on the hair loss and the hair restoration, which I still suffer from it because some hair loss you can't prevent.
Yes, ma'am.
Hair follicles are already gone. It's not going to come back unless you're going to be a good candidate for a hair transplant. Or you go to Turkey, or you stay here in the U.S. You know, it's going to cost more, but there are options out here.
Yes, ma'am.
So patients with alopecia, and that might be within their DNA or a genetic type of thing going on. Alopecia, can this address that, or it's just more if you've had hair and then you start to lose them?
Well, it's what type of alopecia? Alopecia is like the generic term. You have several. You have telogen effluvium. You have traction alopecia, where people wear the wigs, and you have that traction. And you know, we're in that generation. I don't know how old you are, Brandon, but for me, I'm 51. People used to wear all these wigs. I guess back when like Tina Turner and them all was dating.
Yes, ma'am.
It went from the wigs to hair pieces, and now we have the perms, and now people using hot combs. So when you look back at our generation, you see more people with hair loss, hair problems, all this traction, and of course, we're wearing a lot of wigs.
Yes, ma'am.
Wigs. You know?
Yes, ma'am.
So that is really affecting the black. Oh, and don't let me forget the braids.
Yes, ma'am.
These heavy braids. I'm not trying to prevent anybody from wearing braids. I love them too. But if your hair is not strong, you should not be wearing braids.
Is that
find a protective hairstyle?
Is that why people have like the people that have braids? I see often it starts receding back and back and back and back and back until there's nothing there.
Exactly. It's like, okay, you got to stop and catch it. If you catch it early, like your mother was asking me how long, I don't know until we try it, and we have to see. It works, but it's just going to take slower. But the thing, what you just said, they continue to get the braids, and the braids are going further back. It's like, why are you doing this?
Yeah, no, you're right.
Finding kids, parents doing that to themselves are doing it to the kids. So what's happening to the kids?
Braiding their hair so tight.
Yeah.
Now they're coming up with bald spots around the end.
Absolutely. Question for you, actually. Sorry, Mom. So I can grow a beard on this side of the face, but not on this side. Now, if my question is this, because I know it's game over the minute I'm able to grow a beard. Is it possible to get like needling? Is there something I can get needling to get? Okay, tell us about that, because I cannot. It's not this. It's over. It's game over for me in the movie business. The minute I can grow that beard, it's game over.
Yeah. So I don't know how long. So I need like a history. How long has that been happening?
I've never been able to grow a beard since I was when I finally started being able to grow facial hair over here maybe 5 years ago. But this side's always been like that.
Yeah, I will have to look at those follicles and see if you have some damage there or some scarring there or some kind of genetic problem there. But my thing is, you have to try to see doing the PRP, because you don't know who it's going to work for and who is not. It's your blood. Okay.
Absolutely. So let's say if I came in and tried, let's just say I put myself as a candidate for that. What would be the steps would be what? I think you said that, will you explain the steps? Let's say I'm a candidate for trying this out right now because I want it to be game over time.
Yes. You come in, I need your labs. I want to see what your blood work is like. Are you a good candidate? I'll go through your history and I'll do a full history, check your medicines, look at your scalp. I will look at your follicles with the camera, the dermoscope. Look at that. Your labs are going to be the most important because I want to just see if you're a great candidate. And one thing, all that, you have to sign your consent. So you don't want to sue me if something.
Of course, yeah.
Okay.
Yeah.
But one thing that I'm a big thing on, I need for you to read up about the information that you get, what you want me to do to you. I don't want to give you information and you not understand what I'm doing.
Absolutely.
Exactly.
I feel like that is the biggest problem. People want to just come in here and give it to me, and then something doesn't go the way they want. Now it's your fault. No, I need for you to understand what we're doing. This is an investment. This is an investment in yourself. And if you don't pay attention to what you're investing in, how are you going to get a good return?
Absolutely.
You have to follow the instructions. You have to not eat you have to change your diet, because inflammation is one of the major causes of this hair loss. And I don't know if you keep a lot of beard bumps there or whatever.
No, I don't. I can't grow hair that'll save my life. So
but you have skin. You still have skin there. So do you get a lot? Do you have acne?
No, I don't.
None of that.
Not now.
I not now. When I was a kid, I did, but not now.
Yeah. So those are the things. So we just need to, once we get your history, your lab work. Okay. Next is just draw your blood. Take blood, wash you off. One thing I do like to do is give vitamins. Okay.
Oh yeah. Let's talk about that.
Vitamins. It is power in vitamins, not the ones that you take by mouth. You can take that, but I need it in there instantly. If I draw your blood. So I also do the vitamins. I do more of the injection because I can do that quickly. And it's certain vitamins that you need that I like to give for PRP.
Okay.
B complex, biotin, B12, glutathione. If you haven't heard about glutathione is one of the antioxidant. It also helps decrease inflammation as well as increase immunity.
Okay.
People who have weak immune systems. So, and vitamin D. You didn't know vitamin D is so important in skin, hair, nails, your mood, your hormonal imbalance. I give you all those vitamins before I draw your blood.
Okay. Wow.
Okay. Because I want it circulating in the blood when I give it to you. So by that time, I'm washing you up. I'm doing all this other stuff. I'm washing your face. I'm putting numbing cream on there so it can last either it's your hair or your face for about 15 to 30 minutes. So
yes, ma'am.
You can be comfortable. I don't think it works, but for the customer comfort, we'll do it. But I have a high pain tolerance. I don't use numbing cream. Let's just go. That's just how I am. Oh, wow. Once we do all that, Brandon, then we inject. So then you come back. And also, Brandon, there are other things you can do. You can go get a massager. You can do red light therapy. You can get the eye restore, the helmet. That they have one for the face as well. Okay. It also increases blood circulation to the skin.
Oh, interesting. All right. Well, look, I said it's game over the minute I can grow this beard.
Yes. You help.
I like you the way it is. I like the way it is.
Yeah.
But how about adverse events? Have you had patients to have any reactions to anything at their own platelets?
No, I have not had anyone. The highest risk that can happen is infection.
Okay, and that's with anything though.
Excuse me.
That can be infection. That can be with anything. It's not. It can be with any number of factors.
Yeah, but it's all in the cleaning process. I will give you instructions on all of this. I have you to wash your hair the night before. Now I'm going to tell you, some people come in and have not washed their hair.
Oh,
wow.
So if you don't wash your hair and it's been 2 weeks, do you want me sticking needles into your hair?
Exactly. Yeah, that's going to cause an infection, if anything.
That's the biggest risk. And I've had to turn some people that you have to go wash your hair. I don't have a sink in here. I'm not a hairstylist. I'm not a hairstylist. I don't do that, but
exactly
work with hairstylists. And also I have my hairstylist referral program.
Oh,
if
nice.
people want to work with me, and you know, me offering these services, I do more than just the PRP. And when I can't do PRP, that's where the exosomes. You can also use it for your scalp.
Absolutely.
Oh,
Tiffany, one thing I just want to say along the lines of what you're saying about people having to stick to the process. If I can help you out in a bit, for me explaining to someone who's just like the normal person, it's the same thing as working out. You're not going to be the most in shape person in the world if you start working out today. It takes months. It takes years to look like even me, for instance. Like it took years for me to build to look like the way I do. I'm a lot bigger than I look on camera, trust me.
Yeah.
But that doesn't happen overnight. Just like with your process. So what you want your clients to know is the fact that it's going to take time. You're not going to see the results overnight. And then also, what are you doing outside of here? Now, a lot of, just to go along that line to help you with this, trainers, there's out of shape trainers all over the place. I feel like that you want to look like what your results going to be like. So if your trainer doesn't look like, or if they're older, I can understand, but like you have to make sure that you're doing everything. If you're putting bad stuff into your body, like you said, then you are not going to get the same results. So I just wanted to put working out to what you're trying to say. I'm just dumbing it down and I'm explaining it for the average person.
Yes, that is correct. You have to, your food, what you put in, you have these allergies, and that brings me to hair analysis. So even for you, Brandon, in that beard, we can, if you can grow about an inch somewhere,
I'll take it.
you have hair on your head. If you grow out an inch, that we can take a hair sample and send it in and see what toxins or hormonal imbalances that you have that may be preventing.
Wait, you said an inch on the beard?
Or you don't have one.
Yeah, exactly. Say that's going to take like a year or two.
Well, he grows a goatee.
I grow a goatee like it's nobody's business.
Yeah,
it
grows really fast.
This side, not this side.
You're not going to get it on this side, but we will take it. It's still your hair, is your body, so we can take it from the back, and that's what Acidic MD. And I would love for you to see these two doctors. They're out of Florida. Dr. Gertie and Dr. Samantha, they're doing the Acidic MD hair test analysis, and I'm going to be working with them. So, and I'm so excited about that because they will explain your results of the hair test. Again, you take 1 inch of the back of the hair. The test costs $497. It's expensive, but what you're getting, you're going to get a one-on-one, a care plan. You're going to get vitamins, all with that package.
Okay. Oh, nice.
And that's a whole total another thing that I'm so excited about as far as the hair, doing the hair analysis testing, because it's going to tell you what's going on in your body.
Okay.
You know, if your hormones are off, or the toxins, or if you have too much inflammation, disease processes, they can tell all this from the hair sample.
Oh, well, Tiffany, do me a favor, if you wouldn't mind, just be a favor for me. If you wouldn't mind asking them if they want to come on this podcast, they're more than welcome to.
To talk about that process as well. Insurance. And I know that some people, I don't know if insurance will cover this because they call it, this is like, this is facelifts and that kind of thing. They cover Botox sometimes is covered if people have migraine headaches.
Yes.
Yeah. But for, I guess, for facial type of things, I don't think any insurance company really covers that. Do they?
Well, the vitamins, they probably will cover any vitamins. Some IVs, it depends on the company. Anything that is health related, maybe healthy things that you can do for yourself. HSA, FSA you can probably use those options. I do take like credit card, Care Credit, Cherry, Klarna, different things like that. But no, insurance will not pay for these things. I get asked that question all the time because, again, it is an investment.
Yeah.
But I also get asked a lot of questions because people don't want to pay the money. Just in case, like you said, you don't have any hair there and it's taken a year. If you don't have any growth, you're going to be like, okay, this is not working. And it only 2 weeks.
Exactly.
So it may take more than that. But there are things, using the right oils, using the right shampoos. Like I said, we just have to know what your background is and what you're doing. But what about your dad? Does he have
my dad unfortunately passed away, but when he was alive, pancreatic cancer. It's pancreatic, sorry. But he was able to grow a beard.
Yeah, he could grow a beard. Mm-hmm.
Yeah, I just got and my brother's able to grow a beard. Sometimes you can't have everything. And I think I think guys like, we're taking that from you.
Listen,
so I think that's where we lie.
Those little hair strips to put on there, I'm okay with you not growing it there.
Yeah, well, I'll be all right.
Brandon, you're handsome.
We'll make it work.
Yeah, but I do believe maybe you need to do the PRP.
Okay.
And exosomes. And far as for me, if I do PRP and I don't get any movement with the PRP, I'm going over to the exosomes.
Okay.
And we'll try that. And there's other things we can do besides the exosomes. Like I said, you have the deer, you have so many different hair, what do you want to call it? Different things that they can put on the scalp.
Okay.
The scalp and the beard. Because I am working with people with beard. You have people with this folliculitis. They have all these bumps or ingrown hair.
Oh, yeah.
Mm-hmm.
Yeah. That's where microneedling coming in to help these men. I even had a series for men.
Really?
Well, it's hard trying to get men to come in here. That's where all this sexual wellness and all that's going to come in, Brandon.
Yes.
Okay, yeah. No, I feel you.
Too.
Well, if it makes you feel any better, I've come to find out that I have friends that are in the military, and I have friends in every single walk of life, and they're the biggest. It's kind of interesting. They did all kinds of things. They served our country and all that, but they're afraid to publicly speak. And come on the podcast. So it could be the same thing where a lot of times men are afraid to go in there because what it comes down to is insecurity and embarrassment.
Yes.
And they shouldn't be that way, because as I tell my friends, you're talking to me. There's nothing to be scared of. It's not live. So the same thing with you. I think it's a thing that they just feel uncomfortable or feel like, it's just too much toxic masculinity out here that needs to be stopped.
I agree. I thank you for bringing this forward. You know, my husband wasn't a big believer of all what I'm doing, but he's one of the biggest believers that want to try some of my products. So
absolutely.
That's because he's had beard problems as well, and we worked on that and getting it to grow back. So yes. Brent, you still have a lot to go there, so you keep telling me. So
yeah, you're right.
See. I'm not working with much.
Yeah, okay. No, yeah, you're right. It can probably with great power comes great responsibility. You have it. Tiffany, I wanted to say this. I love everything you're talking about. One thing I did want to touch on is you started off by saying that you were a not single mom, but you had a kid on the way. So what was that was obviously your driving force, because at 17 years old, that's the thing. You're still a kid yourself. Right. You decided to make the decision to better your life despite the situation. You're like, hey, I got to do something to support myself. And I got this, as mom says, sometimes a little crumb snatcher here that I have to look out for too. So I would like to know your driving, just tell us about that journey. Because I know it wasn't easy.
Yeah, it was not easy by any means. And being a mom, but I can tell you this. Yes, I was pregnant. First time having sex and got pregnant.
Oh, wow.
First time. Of course, my mom wanted to kill me, of course. And I was so afraid to tell her I was pregnant. I just remember that day. And I always wanted to work with underserved girls,
yes, ma'am.
underserved girls, the young girls that get pregnant. But anyway, I can't relate to some people because I had help.
Yes, ma'am.
My mom was there. The baby dad was there. So I always had help, but that was my driving factor, because I looked around. I come from low income. I wasn't in the projects. You know, it's a different. You got the low income projects, and you just have a difference. And in my mind, I always asked my mom, which she worked low income, why do we live like this? Why do we need to be here? So I always wanted more. And again, I was still working at a dead-end job with nowhere to go at 20, thinking this is going to be my life.
Yes, ma'am.
I had to make a change, and I realized I wouldn't be able to take care of my kids if something happened, if this dead-end job let me go.
Oh, yeah, absolutely.
So, but I was a person, too. I always worked more than one job.
Yeah.
You know, even from the age of 15, I had 2 jobs, and I still work a million jobs.
Yeah.
Just in me, but I'm getting older though.
Yes, ma'am.
So my oldest daughter, you know, I worked, I had to help. So I was able to do a lot of things. I was able to go to school, come back from school. And then my husband, of course, was there that I can fall on, because I would get a job, quit a job, get a job. It wasn't, if it didn't align with what I wanted to do.
Yeah, you had that
Yes,
support system around you,
yes.
which
Yeah.
is so important.
That was
Not
support.
everybody has that though. But continue. Oh, sorry, Mom. Did you want to say
No,
something?
I want her to continue.
Yeah,
with that
continue on.
because what we're thinking about is so many young girls, young ladies, and the age group we have on the podcast. Some of the people, they think when they have a baby young that they can't turn it around. They're stuck. And it's so great for you to continue to tell this story because it's so powerful a story. So keep on, Tiffany, with it.
Okay. And also too, because I was a first-time mother, I was enrolled in this program in Memphis, Tennessee. It was called First Time Mothers.
Okay.
Oh, wow.
I think they played a big role in this too, because they literally, and they're actually still doing the research on us, me and my daughter, my oldest.
Yes, yes.
She's 34. So when I'm 51, she's 34. So yeah, we enrolled in this study and I didn't have to buy anything.
Oh, wow.
Because I was a first time mother. I was 16 at the time. I was embarrassed when I went to high school. So my mom took me out of my regular high school and put me in the pregnant school.
Oh, I didn't even know they had that. Yeah, please explain these programs, because there's probably people in Memphis, Tennessee that have this or struggling with this right now. Not struggling, but don't know that there's help out there. So if you would tell everything verbatim, would be great.
Yeah. So yeah, it was called New Mothers Program, and because I went to the pregnant school, that's how I joined them. And we met like once a week, and I would get like my baby diapers. I got a crib, car seat, all this. So that's what I said. I wasn't struggling because I always they only had a few girls. It wasn't a lot. So after I went to the pregnant school, had my baby, they still worked with me. I went back to high school. I graduated from high school. Again, those people had been there, it's 34 years. Now they see me once a year, but they're following my daughter. I don't know with this long time study. And so my daughter is in Dallas, and this is what I'm really happy about. I never thought she was going to graduate. I thought she was going to turn out to be a teenage mom like me.
Oh, really?
Yeah. So I was a kind of a strict parent. Kind of didn't let her go places because I had that fear.
Yes, ma'am.
Yes.
Would be like me.
Yes.
So I was kind of strict on her. But
That's right.
She went to college. She got her bachelor's degree. She got her master's degree. And she's a teacher in Dallas. Okay.
Hey, amen. Look at that.
Yeah.
Everything you did was the right thing to do.
Yeah. So that's what I try to think about. And for people to understand that, yes, your experiences teach you things. I didn't have the tools. I didn't know how to do it, but I know what I wanted for them. And I sacrificed not being at home, working 2 or 3 jobs, even with a husband, because, trying to a car note and all this other stuff, it still was a struggle.
Yes, ma'am.
My second daughter was born in the second part of my life where I had a job or career. So she doesn't understand the struggle like my oldest child.
Yes, ma'am.
Yeah. So my youngest is 27 and she's in PA school right now.
Oh, good for her.
Oh, physician assistant. She's going to be a physician assistant. Oh,
Yes.
wow. That is
And it looks like they're following mom's footsteps to a certain extent.
Yeah.
They both will write scripts, so that's great. Oh, wow.
So that's what I wanted for them. I wanted them to get married first, have babies, do everything right besides how I did it wrong.
Yes, ma'am.
So I was willing to sacrifice or do what I have to do to make sure they had that.
Yes, ma'am. Well, first off, if no one told you, I'm proud of you.
Yeah, I am too, Tiffany.
Yeah.
I mean, I didn't know the depth of your story and what this new mother's program.
New mother study.
Yes, new mother
study, and they are
new mother study. What's so interesting about that? I hear often people talk about, well, why aren't the parents training these kids at home? But if the parent is a teenager as well, you're a child as well, still developing. How can you expect that teenager? And I've said this often to people, well, they should be getting that at home. Wait a minute. The home life might be teenagers having kids.
Yeah.
And so with that, I say that I always want people to rethink their thought process. rethink programs that you take out of the system that help. And I'm so glad that this study they have in Tennessee, I'm going to actually research that study in other states and see if they have a program. I know that some programs are being cut out, but this type of program of educating young people here in this United States of America, and if these programs are offered in many communities, that will just impact the community in such a positive way. It'll get some of the crime off the streets. Some children are raising themselves, and the crime, they become their brother's keeper, as they say, out there with clubs and stuff or gangs they belong to. But if they have another option, and maybe offering these options, maybe that in school, I think they used to do something where you could get a little baby in school and you have to take the baby around with you all day long and let the baby cry. So you can, but I think what your state of Tennessee offered you is so powerful, and the first time I've ever heard of it. So I'm so glad you're sharing it. Now keep on with the story.
Oh yeah, go ahead, Tiffany.
Go ahead.
Hey, and that new mother story, they got funding, so they were doing it in other cities, because I was interested, because I was thinking about, I volunteer my time, even though I'm a nurse practitioner. How can I help? Because that's still what I want to do. My biggest thing is I always want to help people because of where I came from, and me knowing I was a teenage mom, and that people don't have the opportunity. I'm going to tell you, new mother studies changed my way of thinking. That's why I wanted more. And once I start seeing that it's people out here that care about you, and it was mostly Caucasian women that were doing this program at the time. So, they're going to teach you a different way of doing things, and so when you get exposed to things, well, for me anyway, I wanted more. I was exposed.
Correct. That is exactly. Exposure makes a big difference. Exposure makes the biggest difference. I tell people all the time. They said, "Well, this child doesn't know." I said, "Well, this child hasn't had the opportunity." The opportunity to really learn something or see something. Maybe the only place they've ever seen is within their little city, or never been outside their city, outside of their state, to know that something is bigger than where their little world is right now. And I think it's just so much about educating our communities, reaching back and helping like you want to do and like we used to do. My husband and I, Dave Brandon's father, volunteered in the community. We did a lot in the community. I worked with the Ronald McDonald House with people coming from all over the world volunteering. That was a volunteer. I had 2 jobs, and I was volunteering as well in the community. And so with giving back to the community, and we took in
my oldest brother's a guy named Travis Hales, who we took in from the boys' home, who came from a troubled life. Yeah,
we call him his brother. We call him, he's like a son to us, but he was living in a boys' home. And we would bring him to our house on the weekends, and he became our 3rd son. He has another.
I have another brother.
Yeah, so that's what I'm talking about. When you go back and you can reach out to others and see a need and start working on rectifying or changing their thought process. In fact, Travis, I think we had an impact on Travis.
Oh yeah, because Travis is married, and then even though the 2 children aren't his by blood, they are his children.
Yes, he adopted.
They became his children because his wife had two previous children, so those are his children now.
Okay. And so in some some kind of way, he said he saw us. He had never seen a lady, a mother,
black mother and black father
in the household. That's right. And so, and I didn't know certain things. I would see them, but he was just another son. And I guess sometimes you take things for granted. Being with a mother, having a mother and a father. But it's so nice that he recognized that. In fact, he came on the podcast. He writes poetry. He's written how many books?
I think 4 books now.
4 or 5 books.
Accomplished poet.
He's an accomplished poet. Yes, he is. And so that makes my heart feel good. This one child, we can do 1 child, then 2, and then 3. And then with you today, you're talking to so many young girls out there that think maybe pregnant, and this is the end of life for them. And it's not. It's the beginning of a different chapter to make a bigger difference. Okay. So that's why it's so important.
But I can tell you, if you have all this extra help, a lot of girls tend to get in trouble still and come back with 2 and 3 more.
Lord knows that's the truth, but yeah.
Oh,
So,
wow.
you know, and for me, that's, and I, like I said, I tried to raise my girls that way. I only have 2. I didn't want any more. Okay.
Yes, ma'am.
2 was my limit. So now my oldest has 2 and her husband want another one. I said, no, ma'am.
Yeah.
2 is good.
Yeah.
I'm gonna stick at 2 because they don't understand. I don't know what it's like besides 2 children, and it just, things are expensive. You know, you have childcare, you have to work a whole nother job, or you need to stay at home for this childcare.
Oh yeah.
Yes.
I'm not gonna run her life, but that's just my thought process.
Yes,
About
exactly.
and growing up and seeing people struggle. I don't want that for you, but of course I can't change their mind. It's whatever she decides to do. I just don't want to keep going down to Dallas babysitting.
Oh yeah, that's a lot.
Yeah.
Tiffany, Miss Tiffany, I do want to say this. First off, and I'm going to put you and my mom in the same subject, why I'm so proud of each of you all and how your children are always watching. I developed my work ethic. I volunteer myself. I volunteer with even my parents they never had to tell me to go volunteer because I did it automatically. I volunteered for a wheelchair basketball league for able-bodied and non-able-bodied. So people that are paralyzed or missing a limb, and that's from children all the way to adults. They were paralyzed. I played in the wheelchair basketball league and did adaptive sports with them in California at UCLA, which is an amazing program. But the reason I really relate to your children are always watching, and I have an unmatched work ethic. I still haven't met a person in this lifetime that matches mine, other than my mom and my dad. And with that, I used to see my mom up late at nighttime studying for tests when she was a pharmaceutical sales rep. She'd be, by the time I go to bed at nighttime, by the time I got up the next morning, she'd still be studying and working for those tests because she had to provide for her family. My dad also worked his butt off. Even when he got laid off from jobs, he would still work 2 jobs. He worked as a UPS driver before. That's one of the reasons I treat the janitor with the same level of kindness that I treat the CEO. And I don't mind checking the CEO because I've had to do it a few times in my business, which is a funny story I told him in the 10-minute Brandon Rush show. But it's seeing what our parents do. So by me relating that to you, my mom relating that to you, look at how your daughters have turned out. The way you raised them, they were watching. Yes. They were listening. And you can be proud of the fact that I think you said one's a teacher and the other one's a NA. You say NA? I'm sorry, what you said?
PA.
One's a PA and then the other one's a teacher.
Yes.
And they didn't end up on the wrong side of the track. Even if something did happen, you guys would have done the steps necessarily. But you should be proud and stand tall the fact that not only did you raise them to be their own independent women, but you yourself are still continuing to elevate yourself and show as a prime example of what a mother could do, who at 17 years old, and I know so many guys that aren't jack, they're trash, but they come up with excuses why they can't raise their children and why they can't accomplish something they can't do beyond themselves. It's because they're lazy and they want entitled. But you are a prime example that can show both women and men what is possible.
Thank you, Brandon. Thank you so much.
Great. Thank you. Thank you for having me on to say that, because I think that is the most important thing. You know, when you have to do for other people, it puts something in you, and it always puts something in me. But I can tell you, my mom, literally, I just remember back in the day, she would pay for all my bills. She was working all these jobs, and here I was the one that went out and got pregnant.
Yeah.
So that wasn't fair. So I try to do all I can for my mom now.
Yes, ma'am.
My father's deceased. He was around, but he was Papa was a Rolling Stone. Okay?
I was going to say, was he a Rolling Stone? It sounded like it.
Was. But I enjoyed going with him. Whatever rolling he was doing, I was doing it with him.
Yeah.
I'm honest with you. But I enjoyed that because he was the fun dad. Although him and mom didn't stay together, they were still married, but they didn't stay together.
Yes, ma'am.
I want her to be around that anyways. You know, my mom, the way I work is I got it from her. But it's just, you can do a lot, you know, and I'm not ever going to tell anybody you don't need a man to do it. I'm always for marriage. That's first and foremost. If you can come from a 2-parent home. I've been with my husband now for 30 years.
Okay, congratulations.
30 years. That's a long time.
So ever since I was 20, we've been together. Not, you know, nothing is perfect. You know, it's been ups and downs, of course, for 30 years. But he came from a 2-parent home, and it was almost like him teaching me how it should be with 2 parents, where I've always come from a single parent.
Yes, ma'am.
So that, you know, that was a difference, but I see it now, and I'm
Uh-huh.
51. You know, it took
Yes,
me a
ma'am.
while to understand. So
Mhm.
I do agree. It is better to have a partner in the home that can
Absolutely.
at least be a role model or someone that cares for that family or whoever it may be. Long as you have the support, that's
Mhm.
my biggest takeaway for that.
Absolutely.
But Tiffany, what's so interesting? You're still learning.
Yeah.
You're still letting those brain cells expand. I call it, because they need to be expanded at all times. And I'm looking at all of the courses you're taking to improve, to have your business. And I'm looking at your business behind you, how neat everything is back there, how you have it ready and set up. And you've started to tell us a little bit about that business and how you had. Let me just get up and take
I see the degrees back there, the certifications.
on that
Wait.
wall.
Yes, it's the certifications. All these classes.
Amen. Yeah, let's see them.
All
What's
these.
going on here?
You earned those.
Oh, Tiffany, look
Tell us
at
about
you.
them, Tiffany.
Oh, I have them doubled up behind those pictures. It's like I don't have enough wall space to put everything.
Okay.
But taking all those classes, I was just taking classes, and one of my instructors said, Tiffany, stop taking classes. Stop spending money taking classes. Start doing.
Oh, okay.
Yeah.
Uh-huh.
I can understand. You got to put that in the application. Yeah, he was right. I can understand. Yeah.
Yeah. She said, you're taking these classes, but what are you doing?
Mhm.
So I was because I enjoyed soaking it in, but at the same time, it was really expensive. You
Mhm.
know, in my services include like the PRP, it includes the exosomes, weight loss, vitamin infusions, injections. I do also liquid lipo. A liquid lipo, it
I
breaks
saw
down
that.
the fat cells.
Okay.
Tiffany, I was looking at the information you sent, and of course, Brandon's going to put that out there. He's showing it so everybody can see.
I know you know it, Tiffany, but I'm showing it so the 6.3 million people in 17 countries can see
You
it.
see the different things. That's why he's showing it like that, because they need to see everything that you do.
Yes.
And you have, I'm just looking at the different things on here, like the Blue Hair Harmony Starter Kit and the Blue Essence Vampire Face. What is that about?
It's gonna be someone needling blood, right?
That's the PRP.
Okay, that's what you call it. Okay. And I'm looking at this liquid lipo special. Okay. So you have a plethora, so many things.
I'll hold it.
Yes.
And just,
They know my face already, so you're
And I apologize. There's one that I wanted to list more of all my services, but that does have my information where I'm located.
yes.
Not only is it just those things, I do microneedling, I do skin rejuvenation, I do,
Yes.
like I said, weight loss, sexual wellness. You know, yes, it's a lot, but everything I do works with one of the other things. So if I'm doing your hair, I'm gonna work with your face. If I'm doing PRP for your scalp, I can put it in your face.
Absolutely.
Okay.
Yeah.
I can put it underneath your eye. I can inject it. You know, people that have all these wrinkles and acne scars. Brandon, you probably need some micro needle to kind of help get those cells working.
I know, right? We need me to get to like, I'm like, you ever play video games? I'm at, instead of level 8, well, I'm at level 8, but you know at level 10, that dark character unlocks and you get the, that's what I'm trying to get to. That micro needling, I'm gonna be at level 10. I'm stuck at level 8.
I think you need it. So doing all these things, mine work. I'm just not putting different things out there. My things are going to work. Whatever I do, I'm going to involve the next. So if I do microneedling, we want PRP or exosome with it. If you want a facial, I want to do the PRP or just do a regular facial with skin rejuvenation or just adding exosomes. You can use exosome for your hair, your skin. You can do so much with it. Also, weight loss. With weight loss, you can do vitamins because there are vitamins to help with weight loss. Also, too, because once you start losing weight, you need someone to help with this deflating skin that you're going to have to help tighten it back up. You know, so I try. That's why I put everything that's in alignment that I can offer someone and give them the best service, holistically. Again. That works together, not just got this out here and this service and it doesn't go with anything else. So
so you see all your patients in your office.
Yes.
In your office, okay, with Botox, everything like that. All of your procedures are done within your office.
Yes.
That's great to know.
And
And
I
then-
put them on this, I lay this out and I cover it up. And of course,
Mhm.
clean after every person.
Okay.
So I am, like I said, because I work in the hospital, again, I am a hospitalist, nurse practitioner first.
Yeah.
A
Yeah.
nurse first, then the hospitalist, because I love the critical care of
Yeah.
dealing with guts, gore, and glory. Okay, so that's what
Okay.
Okay.
I do everything here. Of course, yes.
And so you work as a hospitalist nurse practitioner,
Yes.
and then you have hours that you work in your personal office.
Yes. So right now I work, and I've done this for years. I work 7 days on, 10-hour shifts.
Holy smokes.
Yeah, 10-hour shifts for 7 days in a row, and
Mhm.
then I'm off for 7 days.
Okay.
Okay.
So if I take vacation for a whole week, I have 3 weeks off.
Okay.
Mhm.
Yeah.
So I can do a lot. I mean, I can do a lot in 3 weeks. I mean, you're really rested in 3 weeks.
Okay.
My husband always talks about retiring. I'm like, I don't plan on retiring.
That
Yeah.
sounds like my mom.
I will still work, whether
Yeah,
it's
sure.
in, doing volunteering or something like that. I will still work
Mhm.
because
Okay.
you need to be active,
Yeah, absolutely.
not be at home just sitting there. You could go golf, but I think you should be active. You should always keep the brain busy.
Active.
Well, I know one thing. When I left my position, I told the Lord I wanted to be able, because I've been working since I was 13 years of age in a
Yeah.
grocery store. And the man would pay us under the table because we were so young. But I've been working in a grocery store since I was 13. And then from there, I went on to college. And then from there, got recruited, worked for some companies out there. But
Okay.
I can tell you right now, I've always wanted time to read, take time to read. So when I took time off, I spent a year reading my Bible, because that is my manual. That is what I need to know more about, how my life continues to move in this world. And
Yes.
so the Lord gave me time to read my Bible, because sometimes we get caught up so much. We don't take time to read and learn about what God wants us to learn about. And so with that said, then I got a chance to read more books. And I have libraries. I have books in here, and my parents, we kept books around growing up. So it gave me the opportunity during this little temporary retirement part to read my Bible and take in the United States. My son and I traveled, and just to enjoy this part of life. And then he created this, though he's in the acting world, as you can see, with 77 TV shows and movies.
And
I've
I've
got-
seen so many.
Yeah.
Oh yeah. I'm glad.
I've gotten the chance to see so many things,
Yes,
learn
yes.
so many things, and want to do so many things.
Thank
And
God.
I thank the Lord and I tell people this often, when I was thinking about leaving a company, because I thought I was compromised, I said, you know what, Lord, I need you to do something for me. I said, I need you to agree with me on a certain date for something to happen in my life. And when I was trying to change my mind on that, Tiffany,
Mhm.
my back went out. My back, I've had 5 discs messed up in my back. No clue. And the company I was working with, I'm like, you didn't tell us. I said, well, I didn't know how I'm going to tell you something I did. Well, what the Lord was trying to instill in me, or make me understand, that he knew that it wasn't right for me. And so he tried, and he said, you talked to me about it, and I agreed with you. So now I'm going to make sure that you do not return there. And I appreciate the Lord for being such a powerful force in my life, with my kids and with my family. I just appreciate that. And from there, Brandon created this show. And he said, Mom, because I was thinking about going back to take something part-time or do something in the community, which I will still do something in the community. That's why I was looking at this program that you just mentioned.
Yeah.
But I was so glad that Brandon said, well, Mom, why don't you just come on the podcast with me and you be Mama Rush? But he always called me Mama Rush because he's Brandon Rush. And so when he said that, I said, well, that's a great idea. And we've gotten a chance to meet wonderful people like you,
Sure,
Tiffany.
yeah.
You are sharing so many powerful points and things for people to hear that you are doing. And I know it's impacting people's lives.
Absolutely.
I mean, I've learned so
Even
much.
just between the medicine part, the moms trying to figure out things with these deadbeat dads out here. It was,
Working.
yeah. So,
Working two
and,
jobs.
and you're an inspiration.
And I just tell you, and what you've done with your girls, your
Yeah.
young daughters, and how they're going to make an impact as well. Are they
Already are
already
probably.
making the impact? It just makes me feel so happy. I'm so happy. I'm looking at you like,
Tiffany, I'm glad we got you, Tiffany. We're gonna have to have you back too.
Yeah, I would love to come back. But
yeah.
Brent, I think, how are you in this? And I think I was asking Mama Rush this. I'm like, how is he doing this? He just want to talk to someone. I'm like, a nobody?
So first off, you're not a nobody because you're always somebody in God's eyes. I would tell you, why I did all this. I had a chip on my shoulder because I had to prove to everybody that I was who I thought I was in my movie business.
Okay.
And I've been, there's so many people that had the opportunity to help me out through my career, but God, what they thought would be for my harm, God meant for my good.
Mm-hmm.
So, in 4 days, my mom was thinking about going back to work. I lost my dad, unfortunately, who I loved to death, who was my world, but he was talking to me during the week right before Passover. I said, hey, look, I got to come up with something. I've worked on 77 TV shows and movies, all in the biggest markets in the United States: New York, Los Angeles, Chicago, Atlanta, New Orleans, Pittsburgh, Mexico. And I left out a bunch too, but I was like, hey, I've been in all these, I stripped for Betty White. And I've worked with Clint Eastwood. So it's like all these people, the casting community who I absolutely love. This is almost a love letter to them too, is I'm like, how can I bring all these people together? And I've always made friends everywhere I went on my travels. So I'm like, hey, let me start this. Let me put together this show. And by God's good grace, it has worked out. Everybody that I've asked on, it's because I feel like stories are important. Because when I was I'm not big headed, but when I was stepping on these sets, I realized a lot of people didn't realize I'd been in all this stuff. Okay. So I'm always humble, and I always was just myself. I always brought to it what I could. So finally I'm like, okay, hey, like, look, I have this built-in fan base. I can build this show, and I find people's stories because I was always traveling for all these states. So I always loved hearing people's stories. And they'd be like, what do you do? I'm like, well, I actually work in TV. So, but that's why I think that your story is important, because everyone deserves their spotlight. Me specifically, even in the movie business, I feel like the A-list and all that kind of stuff, they get all the credit when they're not the ones that run everything. It's the crews, it's the casting department, it's the production, it's the writers, it's the director, it's all the people behind the scenes that make it happen. So I'm like, I'm going to flip the script on all of them, which is now I'm showcasing all these people to make this world a better place. And the fact that it's not, the janitor does have that story. It's not just a CEO. That CEO won't be jacked without that janitor making sure everything's clean, because you lose customers that way.
Exactly.
So sorry, man. I call myself a different kind of preacher, but that's kind of what came about.
I really appreciate that. I admired that. And I was telling Mama Rush, I said, wow. I said, I just thought it was a wonderful thing for you to do that, because everyone does have a story.
Yes,
you know, your story may be different from my story. I have like a restaurant I'm in a Solar Salon Suites, and it's Bonefish. And when I get off from what I'm doing, I go over there and have a drink. I'm always meeting at least 2 or 3 people and giving them a card because I like talking to people. Yeah. I don't try to be overly talking. Sometimes I can sit there and people just start talking to me, but I do. I'm like you, Brenda. I do like talking to people. I love hearing people's story. If I can sit in the airport and just watch people go by, I will have the best time just doing it.
Oh yeah, you would see me running by.
See you running by, going to different planes, and just always wonder what's going on in their lives. How did they get to where they are? Before you be in the airport, you have enough money to get somewhere. That's the one thing. It was years before I ever rode a plane. It was years. I was way in my 20s or 30s before I rode my first flight. Got on the first plane. So
yes, ma'am.
Those things are interesting to me. So I think for doing this,
Oh, absolutely.
So, like Brandon said, it's everyday people, and it's fascinating. Everyday people, fascinating. I just love it. And your friend Pam, we have a mutual friend, Pam. And Pam saw us in the salon with Wendy, who died of pancreatic cancer as well. That's what Brandon's dad died of, pancreatic cancer. And so Pam and I had this friendship for years, just going back and forth. She'll call me. Sometimes she'll be in the hospital. Pam is a nurse in the hospital, and she knows Tiffany. And so with that said, when she saw your program, Pam, I showed it to Pam first. I sent Pam over a video. I said, Pam, look what we're doing. Pam told me, girl, I got somebody for you. So, and I was so glad. See, this is what we were talking about, being great with people out there that you meet. Just going to a hair salon and getting to know Pam. And now Pam, and you were there probably, Tiffany. I just don't remember our connection
I
there.
remember your face, but I was there. Just probably didn't talk to you as much, but I was there for your face.
Yeah, I
Absolutely.
was always there with Pam. We'd be over there with the hair dryers, just going back and forth, talking back and forth. And then when Wendy died, she went on a mission to try to find me somebody. And then I went on a mission too. And so I'm so glad we found somebody. She found someone and I found someone here. And I don't have to drive to North Carolina all the time. But with that, this is why this show, I think, is so. Yesterday, Brandon had a casting director on from Hollywood. And
huge casting director.
Huge. In fact, what's the name of the show?
Yellow Jackets. His name's Josh. Josh,
yeah,
and he's a casting associate for Yellow Jackets.
He was on yesterday, so you have to go and look at the podcast with him on yesterday, and we learned so much from him as well. And so with that, we've learned a lot from people, and hopefully, I know our audience has. And so they're continuing to ask questions of us. Like, for instance, you saw Richard with the alopecia part, the hairstylist.
Yes.
Yeah, and that's what she saw, the alopecia part.
Yes.
Tiffany, I did want to say this. Sorry, it's important for me to say this. My dad is a driving force behind this show too. I gave up my career for 18 months to take care of him, and I would do it again. I've made sacrifices just like anyone has for my family, but I said I've walked away from this movie business twice, and I would do it again to take care of my dad like I did. But during that time, this is also for the nurses out there. This show is a big people I keep focusing on in the show is nurses out there, because my doctor's dad was an evil person. The oncologist was extremely evil, but the nurse he treated my dad like a guinea pig and used him as a test subject. But the nurses were the ones that continued to help my dad the whole entire time. So I have so much love for nurses. I've also dated several nurses and a respiratory therapist who I was in love with, who I saw what she went through. She was always that person. And I saw her on the days when things didn't go so well. And so I have this as a platform for you all, because you all are the ones that keep people alive. You guys make a whole lot of sacrifices. You do it with no sleep. So it's not just for, like, the casting community is one thing, and so is the everyday people, but nurses is a big thing that and respiratory therapists is a big thing I'm focusing on here, because those are the ones that were there with me, taking care of my dad.
Yeah. But we do with that, the healthcare profession, period, because we have medical doctors coming on, and we have a medical site as well. We have nurse practitioners, as you are, physician assistants coming on. So everybody might not be not caring in the health profession, but you do have some who are money driven, or have forgotten that you're supposed to love your patients. You're supposed to treat them well, because they make your business. And with that, when we find beautiful people, as you are, Tiffany, it makes our heart feel great, because it still says there's a light that shines on the healthcare profession. That's very important. And that we want to make sure that light continues to glow brightly. Even though we have some bad eggs, like this oncologist that tested and treated David, Brandon's father, David, with experimental drugs. That gives, and that's another thing I want to say. When it comes to people of color, we know that we've been given medications as a test subject. And therefore, that history behind that particular thing, the Tuskegee experiment, that kind of thing has given people of color this idea that, wait a minute, I might be used as a test subject, or this is not right. This medical procedure is not right for me. And so if we can dispel some of that, that would be great.
So Tiffany, so I do have four of my best friends are doctors. I don't screen nurses for this show, but I do screen every single doctor that comes on here. If they come on the show, they got to prove to me first why they're going to be on the show. Because I have a zero tolerance policy.
I'm so listen, I'm so glad I'm not bashing doctors, but I'm gonna tell you something. Me being
but that's why I said the health profession.
Me being a single Black female, I'm gonna tell you, I've had it rough, and I went home for many years crying every day, but I couldn't let people see me cry. That
Yeah.
it's hard. But
Yeah.
that's okay, because you get put in those situations so you can come out of it stronger.
That's
Yes, ma'am.
correct.
I have this thing. Okay, give me the hardest one. Watch me come out of it.
Amen.
Exactly.
Amen.
That's just how it is, because I've been through it. You know.
Yes, ma'am.
Yes. Yes.
That's one thing. But I do believe in working with people. I do believe in collaborating with people.
Absolutely.
We're better together.
Mhm.
And also, Brandon and Mama Rush, you know, I'm also a preceptor because I'm 51. I'm one of the people, as I get older, I'm seeing the new generation come in.
Yes, ma'am.
Yes.
And what you just said, my thing is to make sure I'm training
Yeah.
them. Okay.
Oh, that's great.
Come from what I didn't have it easy. I
Yeah.
had
Mhm.
so when I'm training other people, I'm not going to be easy.
Yeah.
Okay.
I want you to do this because
The
see,
best.
I know if I don't get you right, you're the one who's going to be taking care of me. today.
Amen.
Exactly. So
Amen.
you do
I
the
need you to know,
Yeah. Mhm.
or
Yeah.
I need to get you to care. And I kind of force it on my daughter, who's the PA, so she listens to me.
Yeah.
No,
That's
you're going to have to be where you're taking care of me, and you know what you need to do.
Absolutely.
A lot of people are rushing through this thing now. This is a different world now.
Yeah.
Mhm.
Quick and fast. Even some of the schools are quick and fast.
Yes,
So
ma'am.
that's why I like precepting as well.
Okay.
That's great.
So
Okay.
Question. Is the reason why your daughter decided to be a PA, physician assistant, versus a nurse practitioner, NP?
okay, let me tell you about this.
Okay.
I want her to be a doctor. That's what I wanted her to do because she's just smart like that.
Mhm.
Mhm.
But she didn't want to take all the time to go to school, which a lot of people are not wanting to take all the time and be in a lot of debt.
Yeah.
Uh-huh.
I mean, I'm not going to pay for her education. She's grown now. She can do
Yes,
it.
ma'am.
Figure it out. That's that's where I'm at. Once she will figure it out. Okay.
Uh-huh.
Yeah. So she didn't want to take all the time. So I didn't want her to go to MP school.
Okay.
Okay.
Nurse. I didn't want, because she had to go be a nurse. You had to work as a nurse. Then
Yeah.
you had to go to school. She had already had her biology degree.
Okay.
Oh, wow.
PA school. You know, it's
Mhm.
quicker. You don't have to take the nurse route to be an NP.
Okay.
And
Okay.
to be honest with you, I do like the PA curriculum
Yes.
a bit better than the nursing curriculum.
Okay.
Uh-huh.
I didn't go to PA school because I had a family and I had to work.
I got you.
Yeah.
I
Understandable.
understand.
Nursing was more flexible for me to go, and I was able to do that. And I lived in Charlotte, and I was flying back to Memphis,
Okay.
going back and forth to do my classes at the University of Memphis.
Okay.
Great. So
Amen.
she graduated college and then she went straight on.
No,
Good.
she twiddled her thumb for 4 years because she was too embarrassed to tell me she didn't want to be a doctor.
Oh, wow.
Oh,
Okay.
wow. Well, I told my dad I didn't want to be a physician. My sister is a doctor, and he said, well, Carolyn, I don't want you to take all that mess off of a doctor when you can be a doctor. And I said, well, Dad, we compromised. I said, I know what I will do is I will become a pharmaceutical rep, a specialist in that area. But actually, I was recruited to work in research and development, which I really needed that background for DuPont Company in Delaware. I needed that background as a toxicologist. I went as a toxicologist to know how powerful and how medicines work. That's why I asked some questions in the very beginning. But I needed that background in order to pursue. So when I told my dad I would do that, he said, okay, that's fine.
Yeah.
You're still dealing with them, but you don't have to take orders from them. So he said, in fact, you can educate them. And so that's how it worked out for me.
You was right. And that was one of the same statements I made to her. Why would you want to take orders when you're smart enough to be the doctor?
That's correct.
Yeah.
That's correct. And so,
but you know, I had to let her be because she doesn't want to be in school that long. So I
understand. But I wanted to hear that from you.
Yeah.
Oh man.
I'm still happy. She can still take care of me. That's all I'm saying.
Absolutely.
And and as me as a nurse practitioner and running my business, I have to have a medical doctor to work with. And the doctor that I work with, who's my medical director, and he has his own business as well, is Dr. Sambiso Ranga. So he's the director.
In Charlotte? Is he in Charlotte?
He's
Oh,
in.
great.
So if you all know about nurse practitioners and us having business, we have to collaborate and have a medical
Yes, ma'am.
director with us to look over us that go along with our practice. This is my business, but he has to agree with the protocols and different.
Yes, ma'am.
Oh,
Absolutely.
So not only do you
over.
Oh yeah, excuse me, not to cut you off. What were you saying, Tiffany?
It's like looking over, making sure you are compliant and you're doing the right thing and having the right protocols and the consents. And that's why I was saying about me spending all this money for these classes, because I want to make sure I have the right consent, the right protocols, and I'm doing the right thing.
Absolutely.
Yes. And that's great that you have a check and balance system and working with another doctor to be like an oversight person. Yeah. How about the insurance with that? Do you have to carry more insurance because of that?
Yes, he is under. I carry the malpractice insurance, and he is my malpractice insurance because it's my business.
Okay.
So because I do all the finances for.
Yeah.
Okay.
Yeah, I know that can be expensive because
Yeah.
my sister has to carry hers as a physician. Yeah.
And please know I've done this working my hospital jobs, traveling to other hospitals to fund this business.
Yes, ma'am.
I don't have any partners. I don't get any free extra money. All those I pay for myself. And having a business is a whole nother thing. It's hard, you know. I like this, but I also like my hospital.
Yeah, absolutely.
Yes.
This makes me happy.
Yeah.
I like helping people. You know, maybe I help too much, but I do like helping people. I want them to see the beauty in it. You know,
Absolutely.
But also, I want them to see my worth because I'm going to make you look good.
Yeah, absolutely. Well, with 6.3 million people in 17 countries and 6 continents,
you should.
We're going to make sure you're seeing Tiffany.
Well, one other thing I'm going to say, you know, for Tiffany's sake, I'll show everybody.
Thank you.
Tiffany has June specials, everyone out there. She has June specials. So we will make sure that this information is posted.
Yeah, I will, Tiffany.
And I know I can't show all the viewers right now this information
on my
that,
social
but
media.
Brandon will put it on his page and they'll know how to locate you. We want you busy.
Yeah.
We want you making that money. We want you to make people feel great about changing their appearance or improving on their appearance.
Yeah. Just enhance them.
Enhancing. I like that word. Enhancing their appearance. Yes, that's wonderful.
With Botox, people they don't want to be changed. They just want to look refreshed. So I just want to look refreshed because I'm getting older. I get in the bags and all this other stuff. So I just stick myself again and
at least you know you tried on yourself first, which is another thing.
I'm always going to try everything on myself first before I do it to someone. How else would I explain to them how it works?
Yeah. Tiffany, if I may say this real quick, I've always felt myself personally, just because that's how my dad raised me, and then my mom gave me advice too, but the best way to lead is by out front. Yes. And that's why I'm going to keep it real short here. The reason I went to California, and one of the quotes I live by is when I heard the voice, Isaiah 6:8, which is when I heard the voice of the Lord saying, "Who shall I send and who shall go for us?" I said, "Here am I, send me." I knew that I was going into hell out there. I really did. And God built me to be able to handle that. And now, just like you have gone through all that you went through, I'm relating this to you as well. The reason you've done through all the studying that you have gone through, all the hardships you've gone through, even the times that you probably cried tears to yourself, even the crap you had to put up with people at work sometimes, because there's always that one person on every job. Yes. God built you for this so that you could help someone else. So even though you went through that pain and that struggle and that trial, just like I've been through, it's so that I could help other people, just so my mom could help other people, just like my dad did, and just so you could help people as well. So I appreciate you for going through all that you've done and the sacrifices you've made and for being here today.
Oh, thank you.
I'm a different kind of preacher.
You are. It's surprising. I mean, I'm really impressed. So thank you.
Do you have any more questions of us?
No, I don't. Thank you for having me on. I really appreciate it. I just want to say that much. And I want to send you another QR code because the other one wasn't working. So I sent my June special, but I had another one that shows the services that I use, the products like the Growth Promotalia, the Uracidic MD for the hair and nail test. I can send you that as well. And I'm going to give their information over to you because I think you will love these two doctors, Dr. Gertie and Dr. Samantha.
Okay.
Florida. They have a story and they're so likable and relatable, and they're 2 doctors.
If you vouch for them, then I won't have to screen them.
Listen, I'm gonna tell you, if I vouch for them, I'm not gonna send you anything. You don't screen these. You'll
Oh
see
no, I'm talking about for the show.
yeah, I
No,
know.
that's for the
Yes,
show.
ma'am.
You will see it immediately.
Yes, ma'am.
You'll see the
Okay.
same thing I saw. I agree with you. That's all I can say. I'm
Yes,
gonna-
ma'am. Well,
Well,
please,
tell 'em
please
we're
let them
looking
know.
for-
Yeah,
tell 'em
please.
we're looking for them.
You can give them my number, and then they're welcome to write me, and we'll have them on the show.
All right.
I
Thank you.
Tiffany, get home. Get home. Appreciate you taking the time, and we always give everybody a
Get
clap
home
at the end.
safely. Yeah.
Thank you.
Oh, thank you.
Take care, Tiffany. Thank you so much for your time. You were absolutely wonderful today. I'm sorry we kept you so long, but we appreciate you.
I appreciate you so much, Tiffany.
And I'll get this back to you within 48 hours.
Okay. Yes.
All righty. Bye, Tiffany.
All right.
Oh, she's just been a blessing.
She really has
today.
been.